The retreat is Nigeria's first purpose-built private mental health facility with a vision to providing mental health services, treatment in a serene environment of Ikorodu area. My colleague and I, Dr. Oluwatayo, have both worked for several years in psychiatry, both internationally and Nigeria, and have been involved in teaching, training, and service development over the years. The most challenging thing about mental health conditions is people think that they are lifetime events, that they are conditions that can be infectious, and that there are no treatment interventions that are effective. That's not necessarily the case. What we have is that there is a range of both pharmacological and non-pharmacological treatment interventions that are, and there's a strong growing evidence base in terms of the provision of services for mental health patients. Some of the services that we include comprehensive assessments of individuals who've got mental health difficulties, the use of screening tools to screen and assess for illnesses, the use of therapeutic interventions utilizing trained, competent clinicians such as clinical psychologists, psychiatrists, specialist nurses, occupational therapists, and therapist assistants who would work with the individual to have personalized care plans that addresses the individual's core needs, specifically in relation to whatever condition brings them to the service. Now, who should come to the retreat? We cater for a range of ages. I'd say from the age of 16 upwards up into old age. We provide treatment for a range of different conditions. Quite often, people tend to look at mental illness as from the perspective of an individual who has a severe mental illness, the more severe end of the mental illness, so schizophrenic, hebephrenic schizophrenic patients, probably on the streets. No, we do have quite a range of other conditions, and mental health conditions range from the mild to the severe end of the spectrum. So we do treat patients who have common conditions such as depression, which is low mood, anxiety disorders, stress, life stresses, difficulties with sleep, and maladaptive patterns of coping with some of these stresses, which go on to foster illnesses. That's at the core of what we treat. From the minute you come in, you're welcomed. You come to a welcome environment. You'll meet a range of professionals whose task is aimed at supporting you in your recovery from whatever condition that brings you to contact the service. Why did we choose Ikorodu as a setting, and why not Lekki or Ikoyi and BI? That was intentional. Part of the concept of the retreat is about bringing people out of their comfort zones into areas where, into a serene therapeutic environment that allows the opportunity for recovery in collaboration with professionals who are trained to support them in achieving that. using standardized tools that are established, used globally in supporting that individual's recovery. I think the environment is actually crucial. Quite often, when people go into hospital settings, you go into almost restricted areas where you're expected to stay and complete all the interventions within a restricted space, and in the long term that doesn't tend to be therapeutic. So we thought having that sense of space, the fresh air, away from horns, okadas, generate the sound of generators. That is a crucial element in terms of delivering care within a therapeutic environment. Another thing that makes us unique in the retreat is paperless electronic services, which all our records, medical records, are kept electronically. So we've done away with paper notes, and that allows professionals who have the right levels of access to be able to access your notes and advice globally where interested. We've got a pool of specialists worldwide who can provide specialist interventions where indicated. I want to say once again, mental health should not be a death sentence. The retreat is here to help. Do contact us, come talk to us, and we will work with you to help you get better.